Hi everyone, and welcome to this KidsMatter Early Childhood webinar, Understanding Children's Anxieties and Fears. Thanks for joining us today, and I hope the weather and everything is going, you've had a lovely morning, and hopefully you've had some lunch or you're about to have some along the way. Now, today we're talking about understanding children's anxieties and fears. And that's a really key element of the KidsMatter Early Childhood Initiative. We're a national mental health initiative that's funded by the Department of Health and Beyond Blue. And our initiative has grown into what it is today through a great partnership between Early Childhood Australia, the Australian Psychological Society and Beyond Blue. Today's topic might bring up some emotions for people, and sometimes we can get tricky feelings when we're talking about early childhood and difficulties that do come up in early childhood. So I would also like you to just be mindful of how you're feeling and make sure you have a chat with someone. We're popping up an announcement shortly around a link that you can go to for some more information of places where you can contact, but also there's a great podcast that you can listen to that's been created by members of the KidsMatter Early Childhood community. Now, in this meeting space, we've got a chat section, which we will encourage you to pop all your questions in and talk with each other and talk with us, and we'll also be asking you some reflective questions along the way. You can, however, minimise that chat box, so you just need to click on the little little grey arrow near the chat box. So to minimise it and to bring it back again. There's also some little yellow dots that mean that you can expand or minimise the screens to your liking. Now down the bottom you can see the self-care announcement message that we've popped up. If you find that you want to get rid of those announcement messages as well, and I'm just going to get rid of mine, you just press that little cross at the top right of that box. So that's about it. We'll do a few polls along the way, and in a moment I'll be introducing two of my favourite facilitators, Glenda, Grummet and Kerry, Bidwell, who will be talking about that. But before we go any further, I would actually like to acknowledge the traditional custodians of the many different places that we're all meeting on today. I'd like to pay my respects to elders past, present and future for the continuing custodianship of the land and the children across this land. As we explore together during today's webinar, I also ask you to consider, identify and commit to intentional steps that you can make personally towards reconciliation. So you can see an announcement that's just popped up. We've just wanted to highlight, if you're in the process of developing a reconciliation action plan, there is the Narragansett website through Reconciliation Australia, which can guide you through that process. So now, without any further ado, I'd like to actually welcome Glenda and Kerry. Hi everyone.
Hi everyone. Hi Amelia. Hi everybody.
I'll leave you to it. I'll pop back shortly.
Okay, in today's session we're going to talk about what is anxiety, how anxiety looks at different ages, so right from babies through to preschoolers. We're going to take a mental health lens using KidsMatter to understand anxiety, and then we're going to talk about some strategies that educators and parents or caregivers can use. And then the next steps, including referral processes for children, families and educators.
Thanks, Kerry. When Kerry and I were developing this webinar, we took into consideration the fact that all of you and all of us are at different stages in our learning journey. So we came up with some learning outcomes, which you can see on your screen there, and they've been developed to increase our collective and our individual understanding and build our knowledge around children's mental health and wellbeing, so that we can more effectively support the children, parents and our educators that are part of our early childhood education and care services. We're going to do a poll just to start off with, so let's have a look at this one.
Yeah, we're just popping it up now, Glenda. Oh, it's disappeared. Oh, here it is. So this is looking at what we're most concerned about. I'll just start it now. So there's lots of options that people can choose from. So
okay,
we'll get that started. So what in your travels and conversations that you have with other educators, what things do you notice that people become most concerned about?
Well, I think that there's a range, Amelia, from the conversations I've had. I guess some of the concerns have been around those extreme externalising behaviours, and then educators are also concerned about children who might be particularly quiet or shy, and how to actually work with those children whilst we've got some other children that are taking up a lot of our time.
Yeah, definitely. And we're getting a bit of a spread across the board. How about you, Kerry? Do you find similar to what Glenda said, or something different?
Yeah, I think what Glenda says is very true for some of the experiences that have been fed back from educators. Also, separation distress is a big one, and I think lots of people are concerned about that, particularly with younger children.
Yeah, so I've just stopped the poll now. Experiencing a few delays, I think, with our internet, so we just need to stop the poll as we're waiting for that to come up. I'll just pop that up now. So as you can see, there's lots of people around the emotional regulation difficulties and the distress that children experience when separating from caregivers have been the two really key things that people have said. So we've got also some people have put some other stuff, and we've been told about in the chat. There's some stuff around home instabilities and domestic violence and children's responses to that, and how that can perpetuate and get to lead into anxiety as well and fears. So I'll pop off again for a little bit, and looks like that we'll be unpacking a little bit more with Kerry now around what anxiety is and what it looks like in early childhood. Thanks, Kerry.
Thanks, Amelia. Yeah, some interesting responses there, wasn't it? I think it's always useful in this area to think about the purpose that anxiety might serve with young children, and that helps us to understand what anxiety is all about. So it is a normal part of being a human being. It provides us with an inbuilt alarm system, an emotional alarm system that responds to the anticipation of danger or threat. And this often means that fear is a part of our biological makeup as human beings. Most fears and anxiety in children can be understood as part of normal developmental milestones and stages. Children's fears do resolve over time and without intervention. So I think it's good for us as educators to keep that in mind, that we don't always have to take steps to resolve that. It is part of the developmental process with younger children. However, there are some children who experience anxiety more strongly and more readily than others, and they worry excessively, or they show extreme distress and avoidance, and their physical arousal levels, emotional state and cognitive processing are all affected. And it can become difficult for those children to engage or participate in learning experiences or engage socially. So this diagram, which is commonly known as a stress curve, and it was developed by two psychologists, Yerkes and Dodson, it can help us explain the relationship between level of arousal, which is often associated with anxiety, and performance with young children. We know that a moderate level of arousal or stress is optimal for children's engagement and learning, and that in this state, most children are alert, attentive, aware of their environment, and able to approach and explore things with interest. But when children are over-aroused and experiencing high levels of stress, it's very difficult for them to maintain things like attention and emotional regulation and awareness of their environment. And children may be at risk of developing anxiety, fears and avoidance. Some of the research from Harvard University tells us that when children are exposed early to situations that are extreme or produce persistent fear and chronic anxiety, this can have lifelong consequences. And it does disrupt the developing architecture of the brain, especially in those areas involved in emotions and learning. And we see this in children that have experienced chronic trauma. While typical fears do disappear with age, The fear and anxiety elicited by chronic situations such as ongoing physical and sexual abuse don't. And this is why early intervention is so important. Identification during the preschool years is also important because this is a time when children are beginning to develop self-reflective awareness of their own anxious tendencies as well as an awareness of the view of others. Okay, so I think it's good now to think about a reflective question. What do we actually notice about the anxious behaviours of children at different ages? Let's have a look at those questions.
So Kerry, what we've had come through so far has been some specific questions about certain children, and some of it is around selective mutism that comes along with the anxiety, and wondering how to get that happening in the classroom in the early childhood setting as well. So that's one of the things that has come up, and I'm thinking we might be able to cover some of that later on when you talk a little bit more about strategies in general. But do you have any thoughts just at the moment that you'd like to respond to?
Around selective mutism or general aspects in the classroom? Yeah, it's a really interesting condition, I think, and there is some information actually in some of our KidsMatter information sheets and our e-books, which is really good to look at. I think, as in most anxiety disorders or most children who are showing anxious types of problems, I think it's always useful to look at it more holistically and understand what might be happening with that child and what might be some of the contributing factors. That's a sort of place to start. So we're going to have a look at that very shortly.
Yeah, and again, some of that will be different for different ages, won't it? What you do and how you respond, but a lot of it does stem in the relationship that you build up with the children too.
Yeah,
do you have any thoughts at all, Glenda, about some of the things that have been coming up in the chat?
Yeah, I've just been looking at some of the chat questions, and someone's been talking about that children get upset either when some children are not close to them or when other children become close to them. So it seems like that's a fair amount of concern for educators, and that's understandable as well. But as Kerry said, we will be looking at some strategies later on. So hopefully we'll be able to touch on those and answer some of those questions as well.
Excellent. Okay, so should we lead into the next conversation now, Glenda, where you're going to explain some anxiety and fear responses through the general ages that we go through?
Absolutely. So we'll have a little look and see what our experts and references are saying about ages and stages for children's anxiety.
See you soon.
So let's think about babies to start with. You know, it's important for us to consider what is a normal part of a young child's development. You know, what fears and anxieties can we actually expect as part of the norm and when to be concerned. We know that babies and toddlers and preschoolers experience periods of rapid development with variations in how they express their behaviour. This creates, I guess, a bit of a difficulty for us in determining what are concerning behaviours and what are a normal part of the child's developing ability to be able to cope. We also, in this, want to look at, through our KidsMatter mental health and wellbeing lens, as Amelia said before, to ensure that we're providing protective factors for children's mental health and wellbeing, so that we're really attuned to what are the risk factors and what are the concerns, because we certainly know that early intervention is important and can actually really support children's development so that fears and anxieties don't turn into phobias. In terms of early childhood and babies, it's very normal for children to feel anxious and fearful. We know that all young babies have times and periods of crying as they adjust to their world and they adjust to their caregivers, and particularly where you've got some babies that have come into your service that are around about that 3 months of age. We know that they're starting to settle a little bit, but just the fact that they're actually in a childcare and away from parents, it can actually upset them for a period of time. But generally, by about 3 months of age, most babies have settled. Certainly supporting parents' mental health and wellbeing around this time is really important, because we know that when parents feel anxious or concerned or upset or are experiencing postnatal depression, then that's actually transferred onto the children. Actual anxiety, we really can't be distinguished until around about that 6 months of age. When younger infants or babies cry, they're showing distress, but it's usually due to some kind of physical discomfort. Babies around about 6 to 12 months of age are learning that things exist without seeing them. But often with this realisation comes an increased anxiety when baby is separate from parents. So you might hear parents talking a lot about that their babies are suddenly crying more at bedtime when they're left with a babysitter, or they can go through more extended periods of being upset when they're left with childcare. We can expect then that babies will respond and be fearful of loud noises and strangers, unexpected events that send them out of their routine, and also around that separation anxiety. But when should we really be concerned around this age group? For birth to 6 months of age, really where there's ongoing crying periods, or you get that ongoing high-pitched crying where children can't be settled or soothed. Often the babies will stiffen and arch their back and tend to avoid face contact with the adult. Or you might notice them cueing you into the fact that they're becoming overwhelmed by their environment by turning away. 6 to 12 months of age, being unable to settle at sleep time, they're avoiding interactions altogether, perhaps there's no adult preference, and then they're unable to be settled or soothed, would be areas that we'd be thinking that there's just a few little red flags there that we actually need to take some more observations around. Let's think of toddlers. Toddlers are learning more about being a separate person, and they're building their sense of self through what's mirrored back to them. They're also testing their independence, and they're saying no a lot. And I'm sure those of you that are in the toddlers room will hear that word quite a bit as they start to vocalise that independence. They don't have control over their feelings, so tantrums, maybe frustrated outbursts are common, very common in this age group. They're often afraid of both their strong emotions, so when they get upset, but also when adults get upset with them. So they're really fearful of some of those strong emotions. They really require our support and understanding as they move more towards independence. And they also need that comfort as they test out their emotions. So I guess it's about understanding that they will go through periods of unsettledness, but that we're respectful and supportive and help them as they go through that time. So some of the norms, as you can see on the screen there, what to expect. Strong emotions, maybe they're afraid of animals. Maybe there's what we would term as perhaps some irrational fears, maybe weather or thunderstorms or lightning can actually set them off as well. But when to be concerned? Because if that's the normal part of their development, when to be concerned, where there's frequent tantrums. Maybe there's a lot of biting, limited interactions with adult peers, or they avoid activities or avoid others. And they really don't like that close proximity with other children, and they can't be comforted by parents or carers. So for those of you who are now, and perhaps have got preschoolers, let's think about what's happening for preschool children. For 3 to 5-year-olds, there's the fear of physical injury. So there might be the fear of spiders or the dark, monsters, or even swimming. Then there's some other social fears. Maybe there's playing with other children, meeting unfamiliar people, and then separation anxiety, perhaps sleeping by themselves, being away from home. We know that 3-year-olds, particularly in that age group, can become distressed about being left with a babysitter or even attending a preschool or a childcare, and they may go through some of those periods. So they may even have settled as a toddler, but then they're actually a little bit more anxious as a 3-year-old. We know that these fears for most children will actually correct themselves. For older preschoolers, it might be about talking in front of a group of children, maybe making choices. So certainly thinking about that is really important in our preschool years. The other one might be that if they've behaved inappropriately in front of their peers and perhaps they've been reprimanded, that can actually cause some great anxiety for children as well. When to be concerned if there's significant difficulties and perhaps there's a reversing to some baby-like behaviours around sleeping problems, toileting, maybe even some physical symptoms. We know that young children will talk about having butterflies in their tummy or having headaches, and the fact that they are avoidant of wanting to go into social situations and perhaps even won't even go out of the car to get into their early childhood service. So there's some of the things to think about, but we now want to think about what are some of the factors that actually are impinging on this anxiety. So we're going to put up a poll question for you to think about. So what factors impact most on children being anxious?
Okay, we're just popping those up now. Glenda, thank you for that. That's really highlighted how different behaviours present at different stages. I'm just popping the poll up now, but also what came up for me as you were speaking was a lot around there's different ways that children exhibit how they're feeling anxious, and some of that could be the externalising behaviours, but some of it is also the withdrawing ones. And one person did make a comment around that the quiet children can actually be feeling anxious as well. And another thing that came up for me was and Kerry started touching on this, and you sort of brought it more into my mind, was the fact that fear and anxiety, while it can be problematic, it's also a survival strategy and a guide to help keep us safe as well. If we didn't have any fear, that could be just as troubling as having too much fear. So there's been a few questions that have popped up around specific age groups, and a lot of that has been around how do we support parents with the anxious behaviours that children are having, and how to build up that relationship and that partnership with parents about working with it. I know, Glenda, you use a great example from Circle of Security quite a lot when you speak with people around the two little boats and at transition time, and around anxiety. If the boats need to stay close together, otherwise the child doesn't quite know where they're at. And someone else mentioned, I can't remember who it was, sorry for getting your name, but she had a really great quote around taking the rush out of the day. And that's a really important thing as well, because if everyone's feeling rushed, that's just creating to those stress levels too. Any comments or anything while I stop the poll, Kerry and Glenda?
I think what you're saying about parental roles is really important too, Amelia, and I noticed Donna and Melissa made some comments about how do we support parents, if they're feeling anxious themselves, or what are the role of parents. And I think that is really important, because we know that there is, a lot of factors around modelling and, some inadvertent teaching that sometimes we need to look at. So we'll go on to explore that a little more later.
And that has really come up in the poll results. A lot of people have mentioned that the way children are parented can contribute to the way children feel anxious, but also they've identified that temperament and early experiences that children have can also influence quite heavily. And there's a few others, and I might pop back to you shortly and let you know what those are when I have a look at what everyone's commented on. Any other comments before we go on to the next section that you're going to be covering, Kerry, that unpacks all this a little bit more?
No, let's move on.
Okay, cool.
So we're interested in how anxiety actually does develop, and what are some of the contributing factors that impact on the development and maintenance of anxious behaviours in young children. And we noticed through the poll that that you did raise quite a few of those, and I think we'll have a look at some of those because they're interesting, I think, when we try and understand, you know, what do we do as a form of intervention in this area. So we do know that fears can be inborn, that there are some biological links, that some fears and anxiety is learned and that others are taught. Temperament is sometimes a factor. So some children do have an anxious, inhibited temperament, and differences in children's temperament can be seen even in infancy. And these have been shown to be consistent over time. So sometimes we do need to take extra care with those babies or toddlers or children that are needing some additional support in this area. Another reason that a child may be more fearful than expected is that the primary caregiver also suffers from fears or anxiety. We know anxiety is very infectious and it can be caught from other people quite easily. So if you think about a situation where people are in an elevator that stops unexpectedly, for example, and the panic that starts to emanate maybe from people who are stuck between floors, and one person starts to express that fear, you get a bit of an idea of how quickly that kind of fear can spread. So for children, parents do act as their first teacher, or for primary caregivers, their first teacher of emotional coping, and there may be some inadvertent modelling of anxiety when faced with certain situations. But I think our role is not to blame parents here or caregivers, it's to look at, you know, how parents and others can support children. I think where we're sensitive to a child's temperamental style and we can recognise the child's unique strengths, we can certainly make that child's life smoother. For example, where we do have an anxiety-prone child, that child may need to practice at events the behaviours that are expected of them in order to help them deal with any new situation. So if they're going into a situation that's new or that's scary, we may need to give them that opportunity to practice and to start developing that coping. If a child has other stressful events in his life, he may not have the opportunity to develop strategies to deal with his fears. So there may be a lot of other things that are going on and preventing that kind of learning. So sometimes we need to clear the space a bit before we can actually deal with the fears. And some of those things might be environmental kind of factors impacting. There's other factors that also affect a child's ability to deal with fears. The child may have had a bad experience with fear in real life. So if you think of a child who may have actually been bitten or attacked by a dog, sometimes caregivers, you know, can increase a child's fears by being too sympathetic and reinforcing that fear rather than helping the child cope with and manage that distress. But we certainly don't want to underestimate the child's feelings, and we don't want to minimise that. It's very important, I think, that we acknowledge children's fears and the reality of those fears, and that we take very gradual steps. And often that means we need to go slowly to expose children to situations that they're afraid of and give them coping skills along the way. We don't want to overwhelm them and cause more fear. I think that's a really important point to keep in mind. Okay, so we've had a look at some of the key factors around how anxiety develops. Let's move on now to how we can start to work in this area with younger children. One of the tools that we use in KidsMatter to assist with observation and collecting information about children is the Bidwell tool. And this is really important to be able to collect information or to observe children well, how they're thinking and feeling, so that we can start to work on what might be influencing the development of anxiety or why it's maintaining. So the Bidwell tool is and provides us with a mental health lens to better understand children's behaviour and the types of factors, both risk and protective factors that could be influencing that behaviour. There's 5 key areas of the Bidwell tool. And I'll go through and highlight those. The first one is around behaviour, what's the child doing? The second one is emotions, what might the child be feeling? Thoughts, what's the child thinking? And learning, what learning areas are being affected? And social relationships, what social areas are being affected? So we can scan and look across each of those key areas and start to jot down or talk with parents about what might be happening at home and start to get a bit of a picture of what's going on for this child. We can build up a picture of the factors that we need to change and those that will help build resilience and coping skills to assist children to be aware of and manage fears and anxiety. So just a quick example, if you had a child who had a fear of the dark, you might start to look at behaviours in terms of what are they doing, like not wanting to go to bed at night. They may be crying or clinging. Some of the emotions they may be expressing could be around feeling scared, feeling sad, perhaps even angry. The thoughts that we'd be wanting to explore here, some younger children might have difficulty expressing some of those, but we might be focusing on things like, well, bad things happen to me at night, or there may be monsters that will hurt me at night. And those kinds of things, even lack of sleep, and trying to deal with those fears from a child's perspective certainly do affect learning and relationships. And that can be quite a significant kind of factor. Okay, so we'll come back to this a little later, but we're going to have a look at a video now, which you can think about some of the questions on the Beatles tool when we're looking at that. But this is a video showing Rosie, who's a young child, in a long day care centre as she arrives at the service in the morning. And as we watch Rosie, have a think about the questions on the screen. Let's get those up. It's arrival time at this centre. Think about what Rosie's doing, thinking, feeling.
Hello. Coming in. School this morning. Hello, Rosie. How you been? You want to come and do a drawing? Want a cuddle? Hello. How are you? Had a good week? Is Dad off to work? It's cold.
See you, big girl. See you at the end of the day, hey?
I see you, Dad. It's okay. It's always a bit sad when Dad first goes. Yes. Bye. Oh, sweetheart. What do you want to do? You want to do a drawing? Going to go look out the window for a bit? See what we can see? See if we can see those little sausage dogs? We like those sausage dogs that go for walks, don't we? Can we go have a look? Oh, we might see Dad walk past. That's not a sausage dog. Look, here he is. Hi, Dad.
That's not my dad.
That's not your dad. That's Rosie's dad. That's right.
My daddy's outside.
Your daddy's at home. He's not working today. Look, there's that doggy over there. Can you see him? He's having a sleep in the sun.
Oh,
Nice and warm.
sleeping time.
Nice and warm. And there's another dad. Looks like he's taking his little boy. To school?
Yeah. He's at school.
Can we see any other little dogs yet? Where are those sausage dogs?
Sausage dog.
Is that a sausage dog?
That's sausage dog.
Where's the sausage dog?
Excellent. Thanks for that, showing us that video, Kerry and Glenda. I think some things that have come up in the screen was noticing that it's not always practical to talk at the right time, at the time that a child's experiencing high emotion. That's from Melissa. And so sometimes it's just about knowing that and showing a child that you are there for them, and then looking at what you can do once the really strong emotions have passed. And when I say strong emotions, Rosie wasn't necessarily exhibiting those externalising emotions, but her clinging to her educator, that sort of stuff, that indicated for me that there was a strong emotion occurring at that point. So some people have also mentioned that the video didn't work for them. I will endeavour, while Glenda and Kerry are talking in a moment, to pop up the link so that you can watch the video at a later date. We showed it earlier in the chat, but I'll pop it up again while Glenda and Kerry talk a little bit about what they noticed on the video.
So it was great, Glenda. I thought that the educator in this video actually provides a lot of physical reassurance and comfort, and there's no pressure really to try and get Rosie to change activities or to participate. It's a lot of physical reassurance, and I like the way she acknowledged Rosie's feelings. It's really sad, when Dad leaves.
Yes, I agree, Kerry. I think that whilst, and I'm looking at some of the comments saying there might be a bit of a lag in time delay here, so Kerry, but I think that it's lovely to see the way that the educator supported Rosie in this. She had the opportunity to choose which educator she wanted to come to. I think in the comment there's also the fact that the father was quite confident in bringing Rosie in and leaving her, which was also nice. And it was interesting, and I wonder how people felt or would feel when you just see a child stand there. So it might only be for a moment or a period of time, but there was that sense of calmness and stillness, which I think was which was really lovely, which gave Rosie the opportunity to choose which educator to go to.
That's a big thing about that choice that she was given, to be able to choose, because both the educators were very welcoming for her, but she was able to actually select who she wanted. Sorry, I just popped in while I'm off air. I'll pop out again.
Okay. Yeah. I also noticed the role of the parents, in that scenario is interesting too, isn't it? Rosie seems to be in a routine, and the dad there, he comes in very briefly, but he doesn't necessarily stay with Rosie. So although we don't know, how often and how far that's been happening, I think there seems to be a lot of, reassurance that routine is in place.
That's exactly right. We don't know what stage of the process that Rosie is in. Is this Rosie's, is this how she is after experiencing significantly extreme behaviours when at drop off and pick up, which leads in really nicely to what we're going to be talking about next with Glenda, around when is it the time that we need to actually start doing something that's actively seeking support, whether it's referral or putting specific strategies in place to try and support that early intervention process. So we'll leave it to you now, Glenda.
Great, thanks, Amelia. Let's have a think about it. Now, I mean, as some of you have been saying too, not all children will settle as quickly as Rosie did. And as we said to you, we don't know over what period of time. The educators may have worked with Rosie and her father over quite a long period of time to get to this point. But so if not all children will settle as quickly as Rosie, so there are other children who continue to find separation extremely difficult, even despite our best efforts. So how do we know when separation anxiety is turning into separation anxiety disorder? We've highlighted the normal stages of separation anxiety, or just anxiety and fears in general. But we really want to turn our attention to thinking about while separation anxiety is a normal stage of development, separation anxiety disorder isn't. And it can be a serious emotional problem characterised by extreme distress when a child is away from the primary caregiver. The main differences between healthy separation anxiety and separation anxiety disorder are the intensity of the child's fears and whether these fears keep him or her apart from normal activities. So it really interrupts daily activities for the child. We know that there's, as we said before, early identification is really, really important. And there are 4 key areas that we really want to highlight to you, which is all part of our behaviours chart. So once we've looked at behaviour and emotions and thoughts and learning and social relationships, there are 4 key elements that we want to consider. And the first one is pervasiveness. And this refers to the number of settings in which a child is displaying particular behaviours, emotions and thoughts. For example, it might be at the early childhood service, as well as home, as well as when people are visiting friends and family, or when they're down the street, or it may just be in one of those settings. Persistence is another one that we want to think about, and this refers to how long the behaviours, the thoughts and the emotions have been present for. Has this been days, weeks, months? Frequency refers to how often these behaviours and emotions and thoughts are observed. So is it rarely? Is it all the time? Or is it at certain times of the year, perhaps around holiday time and when the child is coming back to their early childhood service? Or is it happening at the beginning of the session or at the end of the day? Severity. This refers to how severe the behaviours, emotions and thoughts are and how much they're influencing the child's day-to-day experiences. It can also be understood in terms of how a child is behaving in relation to other children of the same age. What we know is that the more pervasive, frequent, persistent and severe a particular group of behaviours, emotions or thoughts are, the greater the impact on a child's learning and social relationships. Therefore, it's a higher level of concern. So you can use the behaviours tool through your observations, but consider when you get to your observations, thinking about how pervasive, persistent, frequent and severe. So some of the questions that you might like to just ask yourself is, does the anxiety improve over time? Does the child remain in a highly distressed state for a long period of time and just cannot be soothed? Do parents feel unable to leave the child because it's too distressing for them? And has the child previously been settled and suddenly this changes and remains, so it's continual? So now that we've got an understanding of what normal development is in terms of anxiety and fears, you've done your observations, you've looked at that this child, there is a concern, so you've gone through your pervasiveness, frequency and severity. The thought is, where do we refer to? We know that we can do a lot in an early childhood service by providing early intervention and strategies ourselves, and Kerry's going to go into that in just a minute. But let's turn our thoughts to, where do you refer to? What do you currently do? Who do you refer to when you have got a child who needs some extra support? So I think we've got some chat going there, Amelia.
Yes, we have. So we've got lots of things going around, and something that I just popped in the chat because we talked a little bit about how educators and families might be feeling as well. The great thing I really like about the Beatles observation chart we've got is that it's got a page 2, and the page 2 talks a lot about how you're feeling and also what has been done before, what strategies there are to occur, and that includes where you've gone to seek help as well. So there hasn't been much that I've seen around people giving any examples yet of where they actually seek support from. But do you want to maybe speak a little bit around each of these topics quickly?
Well, I think a really good place to start can certainly be with the people that you already know. So your inclusion support facilitators. Now, because we're a national webinar today, we've got all different sorts of names for these people, so I won't try to name them all, but in terms of people who support you, they might be preschool field officers, for example, so whoever you're actually already connected with. But there may be times when you need perhaps a secondary consult, so you're not sure where to go, so you haven't actually broached the subject with the parents. So there may be someone at your local community health service that you might have already established a relationship with. And I'd probably really encourage the services that I work with to start developing some connections in your local community of people that can actually advise you. You don't have to break any privacy or confidentiality and be concerned about that, but just people that can actually support you, but can also then show you and point you in the right direction. We have a number of places in Victoria that you can do that, and I'm sure you have across your state too. What do you think, Kerry?
Yeah, that's a good summary, Glenda. I think the role of the, the family's general practitioner is always important to keep in mind, certainly when we're thinking of referral to allied health staff or psychologists who often, are a secondary support in terms of working with families in this area. So if you don't have an inclusion support person that you're familiar with, sometimes talking with your local GP about, their recommendations or who to go to, who's in the local area. Primary health networks, are good sources of information too. So I think sometimes we can access psychologists and other practitioners, via those means with a GP referral, and certainly it's worthwhile knowing, whether there's any kind of access to allied psychological services support in your area available. In terms of interventions, we know that in this area, anxiety is very treatable with young children, and if we do intervene early, there's a good chance that you can get much support for children and families. So, when we're talking about interventions like cognitive behavioural interventions as a particular strategy, it's good to know which psychologists and allied health staff might be working in that area.
Yeah, exactly. And that probably leads us into the next area where we're looking at strategies, because knowing where to seek help from, there's a few steps. Once we know where to seek help, there's a few steps that are involved that I think we'll be discussing in the next slide, Kerry, that we need to, in having those conversations with parents, and what we can do in the here and now while we're waiting for referrals to come through as well. Because in a perfect world, we'd be able to knock on the door the next day, but sometimes it doesn't always happen like that, does it? So would you like to talk with us a little bit more about strategies that educators can do in the here and now?
Yeah, thanks, Amelia. And you're certainly right. There's long waiting lists for many parents and communities, and as educators, there's certainly a lot we can do around prevention and in supporting children in this area. So let's have a look at some of those. I like to think of this slide as lovely little intervention bubbles or strategy bubbles. Referral, while it is an important strategy, it's not the only one, and there's a lot we can do to help children who are feeling fearful and anxious. So one of the very first things is to have a look at your record keeping, and when a child enters the service, consider including questions about worries, fears and ways of coping, because that will give you some good information perhaps at the beginning of the year. I mean, do take the time to ask parents about this. So the kinds of things we might be looking for in terms of indicators of risk might be around signs of child anxiety, and Glenda went through some of those today. We might be asking parents about how they respond to that and how they feel about that, and there may be some indicators around parental anxiety there as well. We might be looking at temperament, but some of the other risk factors that aren't so easily observed, might relate to things like insecure patterns of attachment, or there may be traumatic events or parental divorce, for example, happening, and families may not always want to share that. So some of those situations are really important to gain the trust with families where we can. Being aware of normal fears and cultural attitudes and values in this area is really important too. So we can't always expect that anxious children are going to look the same or the parents are going to respond in the same way. I think as educators, observing and listening to children during their experiences and play will provide us with a lot of good information, and we do need to provide comfort and security. So going back to that idea that where children are feeling fearful, then we develop that secure attachment by being consistent around our responses. With older children, problem-solving approaches work really well, I think, both at a general level and where we're trying to deal with specific kinds of fears or anxieties. And we can assist parents with strategies to manage as well in this area. So we can use those problem-solving approaches with parents. So asking children what they might do to solve how they're feeling, or how they're acting and why they avoid certain situations, and asking them, what might be some of the things that they could do that might work for them. So children, going back to our example of, fears of the dark or bedtime, once we know what we're dealing with, it might be something like, well, what could you do? And a child may come up with a response like, well, I think, I need to get the monster spray out and spray under the bed at night. So all those kinds of responses, I think, we can use in a really effective way. One of the big things in this area is preparing in advance if you suspect that an upcoming event or visitor might make some children anxious. Common events that frequently evoke fear include visits by animals, field trips away from the security of the service. I'm sure you can think of other ones, but I think in terms of preparing, we want to be able to answer questions and explain what will happen, and also offer a choice to children. They don't always need to participate at the same level as other children. So we might give them the choice of either interacting, participating, or simply observing sometimes. And talking about how do we ensure, or how will we ensure children's safety is really important. Actually talking to them about how we'll take steps to make sure things are okay. Being a model for coping, just as children mimic words and mannerisms when playing, so they'll imitate your manner of dealing with fears as well. So demonstrating outward calm and confidence, even if you do have inward pangs of panic, it can be very useful. Children do sense confidence just as they sense fear. Peers can also serve as models. It doesn't always have to be an adult. Having children watching peers or other children, even watching videos of how other children cope, can help to decrease anxiety. Other children can be great, positive role models. So we might point out how another child is, or draw attention to the fact that, what those other children are doing as a coping strategy. So if for example, that, you're bringing in guinea pigs to your kindy, or and one particular child doesn't like guinea pigs, we might talk about what's going to happen, several steps along the way. Verbalising coping strategies, for example, can be very useful as well. So an example here might be if a child has is fearful of thunderstorms and the power goes out during the storm, as a teacher or as an educator, we might say, well, look, I'm sure the lights will come back soon. In the meantime, we've got a torch. Sometimes when it's dark, I like to pretend that I'm camping, so we can pretend together. Well, you might have a similar story, but it's got to work for a child in the service. Teaching self-talk is very important. So children can practice saying specific reassuring or encouraging phrases to motivate themselves. So if we think back to the use of the Beatles tool, this is where some of our thinking or cognition might really help us when we're doing observations. We can then start to develop some positive self-talk that children can use in a consistent way. Have a look at some of the experiences you've incorporated into curriculum. Sometimes we might focus if a child has a particular fear, we might want to focus on certain themes, like around dogs, shadows or monsters, maybe even the weather, finding the facts. And I noticed in some of the chat, quite a few people mentioned stories and storybooks and, using stories and experiences to talk about how to do those kind of coping strategies. So that's a really good way to kind of dispel fears as well. And normalising, Glenda talked about, what happens at different ages and stages. So we can talk about what's usual or normal in a 2-year-old or a 4-year-old when it comes to fears. And that can provide a lot of reassurance for children. We can look at our dramatic play or play that we're using. That's a great way and very natural for children to work through fears. We can pretend with children, going on bear hunts, creating a zoo with wild stuffed animals, or going to the dentist or hospital where children have fears of injections and needles. That's and acting some of those out and supporting children. That is a good way to. One of the other ways that and lots of educators are starting to introduce in the service is coping on the physical aspects of anxiety by using things like relaxation or mindfulness, teaching children about breathing strategies. This is a really good way to start to teach children about their bodies and the role that things like breathing and awareness of their breath can help to calm down. So that's a great strategy to use as well. I think the key thing to keep in mind here is that interventions with children at this age, can really help them learn coping skills and can help prevent the formation of unhelpful self-talk or cognitions. And that can go a long way towards improving the child's sense of confidence. So, yeah, the key message, I guess, is intervene early where we can, be aware of, what kind of supports are around, acknowledge children's fears and anxieties, and know that we as educators can do a lot to support them.
Okay, thanks a lot for that, Kerry. Now, I've popped in the chat for everyone to see that we will try and pull together some of the information that has actually come about through the chat, because it's been a very vibrant chat today with lots of people giving each other support and lots of reflective practice occurring. So, which means we've also run out of time almost. We've got a brief 2 minutes left. So unfortunately we won't be able to cover any more of the questions that have popped up, but we will attempt to resolve that through either some Facebook posts or our shared thinking. So remember to follow us on Facebook and our shared thinking blog, and we'll keep in touch with you all that way. Before we head off though, Glenda and Kerry, are there any final thoughts that you would like to share with everyone, from any key messages in a quick 30 seconds?
Very quickly, Amelia. Sorry, Glenda, I was going to say one of the key messages I think is always try and work with parents in partnership around this area where we can. And as we saw with Rosie, acknowledge children's fears and anxieties, and think about the range of coping strategies that you might have available in your service.
Excellent, thank you. What about you, Glenda?
I think about the fact that fears and anxieties are a normal part, and think about how we feel in different situations and put ourselves in children's shoes. I think is really important to do that, and also to be aware that children are sending us cues and signals about how they're feeling. I know one of the comments in the chat box was Rosie was too young to actually express her feelings. Our role is to interpret how she's feeling, put words around that, and model appropriate behaviour for her. So I think that it's really important for us, and I've been reminded of that. So thank you all for your chat. I have been watching that, and it's been great today.
Great, excellent. Thank you. So thanks again, everyone, for attending today. Remember, hang around in a moment. Glenda, Kerry and myself, we will be leaving you, but there will be a survey for you to complete. And if you have got more than one person watching with you at the moment, so that everyone can get a certificate, please fill out the survey and just pop their email addresses and names of people who need the certificates in that spot. So the certificates will come in about a week, or within the week generally, as will an email link to the recording of today's webinar, so you can watch back over it and all the different resources that are available. But we do urge you to continue the conversation, and we'll keep you in touch with the things that have been occurring as well. So thanks again for your participation today and your commitment to, like us, growing healthy minds. Thanks a lot, everyone.
Thanks, everybody.
Thanks, everyone.